I'm going to start off by letting each of you introduce yourself, and I'm going to tell everybody, Barry wasn't aware he was going to be up. One of our speakers was taken ill last night. So Deanne, why don't you tell everybody who you are and what you do?
Hi, everyone. My name is Deanne Mraz-Robinson. I'm a board-certified dermatologist. I practice in Fairfield County in Connecticut. I do aesthetics, I do general dermatology, I do a little bit of everything.
Simeon Wall Jr., I'm a plastic surgeon in Shreveport, Louisiana. All aesthetics, also have a little medical device company, and happy to be here.
Lou Bucky, I'm a plastic surgeon from Philadelphia. I'm sort of the Deanne of Philadelphia. I do both cosmetic and reconstructive and facial and breast, and have a, you're right, and have a active practice in a few locations in Philly.
Tracy Pfeiffer, I'm a board-certified plastic surgeon practicing in New York City and also in the Hamptons. My focus is 100% cosmetic, mostly breast surgery, and I also do a lot of injectable treatments.
Barry DiBernardo on New Jersey Plastic Surgery. I've worked in devices and research and development in devices for the last 20 years, and I also happen to be the ASERV president, which is the research arm of ASAPS.
Okay, so we have 4 members of the Aesthetic Society and our esteemed colleague, Deanne. Would each of you please tell the group, first of all, what are you using now? What modulators, what toxins are you using now? So percentage-wise, let's go right on down the line. So we know where you're starting, then I'm going to ask you where you're going.
I use all 3 neuromodulators currently. I like to, as everyone has mentioned before, create an experience for my patient. So in speaking with them, I have a lot of younger patient population, so I see a lot of millennials, I see a lot of younger people, and they kind of resonate with this as like part of like going to SoulCycle and taking care of themselves. So I probably use about 50% BOTOX, about 40% Xeomin, and then about 10% Dysport currently.
Okay, thank you. Simeon.
Yeah, I just looked at this for this panel, and we're at about 75% BOTOX, which is up from recent years, and about 20% Xeomin, 5%.
I have 8 nurse injectors who inject along with me, and collectively we're about 70% BOTOX, 20% Dysport, and 10% Xeomin.
Unfortunately, I'm the only injector in my practice, and it's 50-50 Botox Dysport.
I was the only one injecting, but we're building an injection army, listening to people like Lou and everybody, and we're building that. We're about 80% Xeomin, 20% Botox.
Okay, so you've just heard from the 3 manufacturers that you're using, and you've heard from 2 that are online, potentially available this year, 1, next year, the other one. So the first question I'd like to ask you is, how important is the duration to you and your patients? If in fact there is a longer duration modulator or toxin, how important is it to you and is it to your patients? We'll just go straight on down the line.
I think it's very important. You know, my patients come in, they don't want to spend all their time coming in to see me. They have lots of other things going on. So having a longer acting neuromodulator that they have a reproducible and we have a confident result in that, I think it's going to be really important. Obviously, I want to see my patients back. I don't want them gone for a year at a time. So I think there's going to be some sort of an interplay there in helping to retain your patients and keep them coming in. But I do think duration is going to be a big factor.
You know, I think for men, David Motizetti was talking about friction points, and, Grant, I know you're focused on this a lot. I think we all are. We're just looking for ways to avoid commoditization, just like all these other heads of the companies we're talking about. And I think duration is going to be really important. For men, I mean, that's the #1 thing. Wait, how many times do I have to get it? Wait, okay, no, forget it. And that they won't even do it because they know it's only going to last for 3 or 4 months, and they don't want the needle stuck in their forehead. So I think that would be a huge differentiator, avoids commoditization, and I'm really looking forward to it. I hope it's real.
Yeah, I think it really has to make a difference to truly make a difference, and I think patients have variable needs. If you have a choice, duration is one of the important variables, but it's not the key variable that brings patients in or has them satisfied with their outcome.
For me, duration is huge because a lot of my patients don't follow up every 3 or 4 months, so they're not getting the optimal result. And they know they need to come in, but like you mentioned, they're just very busy and they can't do it. So I think that would be a huge advantage because the patient's really going to get a value for their investment. They're going to get the result that they deserve, and I think that will benefit us all overall.
I'm not going to argue with duration, but I think the most important word we've seen is compliance. If they're compliant, they look a whole lot better. And the reason I'm bringing this up now is we're one of the betas on the HintMD platform. We have about 100 patients on it, and they're coming back regularly, and they've looked better than I've seen anybody look because they're compliant. So whatever, 4 months, 6 months, if they're compliant, they're looking better, and that's what the goal is.
Okay, we're going to come back down the other direction. I know, Lou, you have something to say. So you talked about compliance, Barry. What is it worth to the patient? In other words, would the patient pay 2x to have complete correction all year long? We hear about premium pricing for one of these toxins. What does that mean to you? If we talk about compliance and complete correction, what are they willing to pay compared to what they're paying now? Just 2x, 1.5x, or anything?
I don't know that it really matters. I think the most important, I don't get a pricing feedback from them. I think what they like is they have an app. It tells them when to come back, and it just tells them what to do. So I'm not sure that the pricing's that big a deal, although they do get something for signing up all year.
Okay. Tracy, your patients pay more for longer duration?
I think they would, yes, because of the convenience of it and the durability of the result.
I don't think it matters much. I think, if we have a toxin that lasts 6 months versus one that lasts 4 months, just like the patient who comes in, it waits for them to be 4.5 or 5 months. If I have a toxin that's 6 months, they're going to wait 7, unless we do something different about the process and encouraging them to come in. We've seen it with fillers. We have fillers with longer longevity. They charge a little bit more, but incrementally, they're not that much of a difference.
I would agree with everything they're talking about. Is that working? I would agree with that. I think that there's always going to be the place next door that's going to just say, well, I'll just give it to you for the same price as BOTOX. So we are conditioned, at least I think all of us up here are conditioned to resist those types of things, and we have to think of other avenues to be able to maintain our price points, maintain our practices, get the patients to come back to us for value adds, things like that. So I would agree with Barry. I don't know if they would or wouldn't, but I wouldn't focus on it.
I think I would echo what Lou said, that, we have these longer acting HA fillers and things that last longer. And at first, I think people were willing to pay a little bit more for them. But as time has come on and we have, an embarrassment of riches in terms of the portfolio that we have, I think the prices equilibrate at some point. So we really have to just drive the experience and what's best for the patient. And if it's using a longer acting toxin for them, great. If not, then you can use one of the already available toxins.
Okay, thank you. Now, we've heard today 2 or 3 times about subscription aesthetic services, and we've heard HintMD. I'm not sure if any of you involved in HintMD will go down the line, but HintMD, as we understand it, is a way in which a patient can budget and pay a convenient monthly payment for a year-long experience. Do you think that will help, or do you think that will increase the frequency? I find it amazing that Allergan's own data, their own Brilliant Distinctions data, shows that the patients are coming in only 1.8 times a year, when we know it should be somewhere between 3 and 4 times a year. I know in my practice I looked at it, it was 1.9. I thought it would be 3.4. I switched to 3.4 with the addition of my Citrus Club, but what do you think about subscription economy and subscription services for aesthetics medicine? Start with the end, go down.
I think it's a great idea. I did a little micro survey just amongst my patients after speaking with the HintMD guys, because I think it's a great idea. I live in a very geographically affluent area, and we're very lucky. And it's sad to say, and as a working woman, I hate to say this, but the majority of my patients are women, and they try to hide these purchases for their husband. So for them, the thought of having this subscription-based plan on their credit card every month that their husbands could track, quote unquote, they didn't like. They'd rather go to the grocery store and add on a gift card and then use those gift cards saved up to come see me. I swear this is real. So I think it's real. I think in the right geographical area, it entirely makes sense. It's going to help improve compliance. I think for my patients, it wouldn't work, but maybe if they have like a way to piggy bank, cards from the grocery store, we can talk on. We'll see what we can do, but maybe it'll work.
That is such a good point that I didn't think about, and what a great perspective. I think, I'm very interested in the subscription aesthetic services because, I guess, as Deanne's pointing out, we just have to remove the stigma of that coming to us and just make it, there's no stigma to getting an iPhone because the iPhone costs $30 a month, right? Because it's subscription-based. Okay, well, mine's 30 or 50. But I think those are the barriers. Those are the things that the companies are working on. Those are what they're looking at. And I've been very impressed with HintMD in particular about how they're approaching it as far as the technology and trying to integrate it into the office with sophisticated or unsophisticated workers in offices. And so, yeah, we're going to do that, and I'm looking forward to it. I think we can really change the dynamic.
How about you, Lou?
Well, I think this is a great example of all that we have to learn from our millennials. The millennials shop like this. They are consumers who like monthly payments. They like subscriptions. They are big consumers. I created 2 of them, and I know how much they consume. I got to now check the grocery bills and all the other gift cards there. But,
You're welcome.
Right, thank you. But nonetheless, I think it is a very active process that is good, and we should embrace it. We are not the target group. I have so much to learn from our kids and the millennials and what we're doing, and by bringing that to this, it's a wonderful thing. The other friction point, if you will, is paying for it, and so financing is an opportunity as well to spread things out and make it affordable. It's a big deal to come out of pocket quite a bit, so we're saying one of the benefits of subscription methods, they can divide it out. But the other benefit is just being aware of how to pay for it and being able to rationalize that spend. And so there's a lot of room to grow from that process.
I like the idea of increasing compliance, whether it's using a subscription service or not. I think increasing compliance is really the ultimate thing, like Barry was talking about. In my practice, we do something very simple. When they book their appointment, when they're checking out, if they keep the appointment, we give them a 10% discount on the charge. So that works really well for us. It's really increased our compliance, and it's very simple.
We're moving towards subscription. As I said, I'm doing it. It seems to be working. We think nothing of $9.99 a month for Netflix. My car wash is doing it. Everyone's joining this. But I wanted to comment on your suburban Connecticut women. So actually, it can work. We have 2 mechanisms for it to work. One is, instead of, say you're doing a lot of fillers and all this, rather than the husband seeing a $2,400, there's like a $199 under the radar, so there's a lower price if they're doing it that way. But I think something they put in now is they can take their food money and prepay it, so it actually doesn't go, there's a way to do that on the program.
So Hint has provided a way to bury it looks like a food
Yes.
card or something?
We'll talk, Barry.
I heard
We'll
that
talk.
Barry's DiBernardo's bill actually comes back as Stop and Shop. It's all hidden.
I thought it was a 99-cent store.
It'd have to be Whole Foods.
That's right.
though.
I'm getting
Then
into
it would be
food now.
believable.
Okay. Next question, changing topics altogether. We heard today from somebody about the short-acting, quick-acting, short-acting toxin, EB001, I think it is. But in any event, do you think there's any need for a short-acting toxin or fast-acting toxin?
There's a small subset of patients who come to me and say, my son's getting married in a week. What can you do? I think it's going to be a small niche of the market, but maybe to have it available for those specific patients. I try to tell people never do anything 2 weeks before a big event, so I'd be breaking my own logic. But if they're there and they're captive and we know it's reproducible and has good results, then perhaps. But other than that, I don't see a big need for it.
If a person comes in and she's the mother of the bride, she's 4 days before and she wants filler, will you do it?
No.
Absolutely, because of bruising and downtime, and you have an instant result. So it fails with my head. But go ahead, Simeon. Do you have a use for a short-acting toxin?
I think, it's the aesthetic conference, and I think we're going to get a different answer from Deanne, being a dermatologist, as we might get from surgeons. So I think the Bontai toxin is intriguing, actually. The more I've learned about it, the more I am intrigued with it, because I think the outside of the aesthetic indications, the therapeutic indications are really intriguing as far as, what is the huge what are patients most afraid of other than the IV, which 80% of the time it's getting an IV, right, for surgery. They're afraid of pain. How much is it going to hurt? How many people are going to have to help me? How long am I going to hurt? Well, I think some of the data that they've shown, and we're going to show this again in Hot Topics on Friday, just as an update, but I think to arrest some of these pain processes and pain cycles that you can just keep them from starting It's extremely intriguing. I think there probably are going to be some good indications for it if it does what they think it does.
Yeah, I actually think there's a great opportunity for short-term duration. One, not as much we think about the impulse shopper, if you will, because you're right, the bruising issue could be a problem. But if somebody needs a boost and you want it to be effective, that's one thing. We do a lot of combination treatments of fillers and toxins where you want to make the forehead not as animated so you can get some longevity. And if you're doing that combination, whether you're a few days before going to the surgery, in my case, it's very nice to be able to treat them a couple days before and then have them blocked, and then you can put your filler du jour in there and have that. So it's just flexibility. It's not going to take over everything, but I think it's a factor or a variable that can be beneficial to many.
I mean, I don't really have anything to add. I agree with all those comments. It's another tool in our toolbox, and I think it could be very effective in certain situations.
I think it's limited. Deanne stole my choice, but the other choice could be they come, there's something that's not perfect. They didn't come in a week later. They came in 3 months later. I go, where were you? And you need it to work for about a month before you do the full treatment again. So I think it has uses, but probably more limited.
I will say, Grant, echoing what Simeon said, some of the therapeutic indications could be amazing, such as zoster, post-herpetic neuralgia, notalgia paresthetica, hyperhidrosis. People who need more of an immediate result, it could be a great therapeutic intervention.
Thank you, Deanne. Okay, at the beginning, we're going to conclude here in a moment, go to lunch. At the beginning, you told us what percentage of toxins you use. Now, you've heard about these two other toxins that are coming in front of the FDA, and allegedly they're going to have longer duration, may or may not. You've heard from them. Now, how do you anticipate utilizing those toxins? Let's say tomorrow they were both available, Evolus and Revance, okay? And I'm not sure if that's what they'll call them. Let's say tomorrow they were available. How's that going to affect your practice?
Honestly, I don't think for my toxin-naive patients it'd be my go-to. I think
one of them?
Either one of them. I think I would start, with the tried and true ones that I have confidence and experience with. I think for some of my other aesthetic patients who are looking for a longer duration, they're a little bit more mature in the field and they know what to expect and they like the look of a toxin. I think the longer acting duration, trying to switch over some of those people will make sense. But again, I have this younger, millennial prejuvenation kind of field that I don't know if the allure of 6 months works for them.
I wouldn't think of this as the injector. I would think of it as to how we could integrate it into our metaspas. And you would need a significant ramp-up time because I think David was talking about having this interaction of the injector with this precision, and Deanne just talked about, this tried and true effect. I think what we've seen as we bring all of our nurse injectors or our PAs in, they have a certain comfort level, and we have to really maintain that or they're not going to be comfortable and we'll fail introducing some of these new products. So there will be a ramp-up period for these companies. I think it'll be really important for them to really support us, similar to like the JET trial with Juvederm, where we've really got a lot of support to ramp them up and get comfort with that. That's probably more important in our scenario, I think, even than the specifics of the duration, maybe the price or things like that.
Yeah, I think an experience trial is very helpful. But I also think that there are patients who, for whatever reason or not, may or may not have been satisfied with one of their previous toxins, whether it's rational or irrational. To have something else to provide for them is a benefit. Even among the big three, if you will, there are people who prefer one over the other that may or may not have any true reason, but the fact that you have both allows them to stay in the practice. And at the very beginning, I'm not the earliest adopter, so I will go with an experience trial, probably utilize people who've had less than an optimal one. It's a great discussion point for our staff, and it's nice to have something new to talk about. It's nice to be able to entertain that discussion. So we at least have something new to entertain a conversation about toxins. They may end up using BOTOX or Dysport, but to have a new toxin on the market to discuss it is a great entry point to something that's been there for, what do we say, 15 years.
I mean, I echo all those things. I love to have a lot of tools at my disposal. I like to feel very comfortable with the products that I'm using, so I definitely would have to become experienced using it myself. I do think that my established patients would like to have the longer-acting product, and I agree that those would be the first patients to convert over. And then there are specific situations where a shorter-acting product would be available. So I think of my established patients, probably 30 to 50% would like to have a longer-acting product.
I'm not going to say anything new from what they all said. I'm hearing that one of the longer acting actually has a better effect on the skin. If that's true, I'll shoot it with my high resolution cameras, and if that's indeed the effect, then I think there's a value added to it, which is different. So I'll be watching for that.
Thank you very much. Thank you, all of you, for your contributions. And we're about to have our lunch break now, provided by Allergan. And it'll be here in this room, and we'll start again at 25 minutes after the hour. Thank you very much.